Good day, dear friends. With you is Natalia on the Doctor Savkina channel, where I share my personal experience, answer your questions, and conduct individual consultations. Thick blood is one of the causes of such serious ailments as hypertension, atherosclerosis, varicose veins, and hemorrhoids, which over time contribute to the development of cardiovascular, renal, and hepatic insufficiency. And in the worst case scenario, it is the culprit of such serious and life-threatening conditions as pulmonary artery thromboembolism, strokes, and heart attacks. Many of us are interested in two questions: how to determine the fact that we, along with you, are the owners of thick blood, and if a thick blood diagnosis has been made, what to do next, and is it necessary to thin it? The syndrome of increased viscosity has a blurred clinical picture. However, it can only be definitively identified with certain tests. However, there are certain symptoms that may indicate this pathology. This includes a feeling of intense thirst, tearfulness, deteriorating vision, memory problems, the presence of noise in the ears, unexplained weakness, drowsiness, and general malaise, a feeling of burning hands and feet, which are always cold, a sensation of pins and needles, dry skin, and daily debilitating depression. So, if you have identified the above symptoms in yourself, there is reason to see a doctor and get tested. And first and foremost, a finger prick blood test or a general clinical blood analysis. The verdict is that thick blood is due to a high level of hemoglobin, erythrocytes, platelets, and hematocrit, with a decrease in the erythrocyte sedimentation rate. What to do next? First of all, it is necessary to determine the cause of the thick blood. For this, it is necessary to do additional examinations. First of all, a biochemical blood test and a blood test for cancer markers should be done, as one of the common causes of thick blood today are oncological diseases, and also a series of instrumental examinations should be conducted. The next question arises: and what diseases and conditions contribute to increased blood viscosity? First of all, it's the dehydration of the body, which is observed, for example, in food poisoning, accompanied by severe vomiting and diarrhea, extensive burns, carbon monoxide poisoning, varicose veins, a whole range of liver, kidney and blood diseases, metabolic syndrome, obesity and diabetes. And by the way, the unfavorable outcome of coronavirus disease 2019 is not coincidentally observed in people suffering from diabetes, hypertension, and obesity. They all have thick blood, which is a direct cause of thromboembolic fatal complication. Long-term use of certain medications can also lead to blood thickening, primarily diuretics, non-steroidal anti-inflammatory drugs, and oral contraceptives. As practice shows, many women who constantly take hormonal drugs for contraception quite often end up in the hospital with a life-threatening diagnosis of pulmonary artery thromboembolism. In any case, even if it is not possible to determine the cause of blood thickening, it is necessary to thin the blood. We will talk about how to do this without resorting to medication in our next video. And now I'm going to reveal a little secret. To determine the thickness of the blood at home on your own, you need 2 drops of blood, obtained by pricking the ring finger with a sterile disposable needle. Drop them on a glass slide and smear them thinly. Next, we follow the formation of the film. If this happens within 5 minutes, it means your blood clotting is elevated and the blood has become thin. Subscribe to my channel so you don't miss out on many new interesting and useful videos. And stay healthy!